ADHD medications weren't always used to treat ADHD, and one example is Ritalin. Keep in mind that many psychiatric medical diagnoses are informed by the cultures and societies in which they exist or are created. ADHD is kind of a modern diagnosis. It's a modern conceptualization about how symptoms like hyperactivity or inattention can affect a person's functioning. Not to say that symptoms which form part of certain illnesses like hyperactivity as part of ADHD don't have historical evidence supporting their existence. 100 years ago, doctors did start to pay attention to these symptoms, especially among children. And one of these doctors was Dr. Charles Bradley, who was a psychiatrist at a home for children with behavioral disturbances, neurological issues. He ended up giving a stimulant medication, an amphetamine-based stimulant medication, Benzedrine, to children. He had hoped that this would help with some headaches, but what he found instead was an improvement in focus in academic performance. Children suddenly became less disruptive, and this was seen as incredible. These stimulant medications had positive effects on children's emotions, on their behaviors, which at the time were thought to be caused by some kind of minimal brain damage or dysfunction. And into the 1940s and beyond, scientists started to turn their attention to the development of new stimulant medications. And in the 1940s, methylphenidate finally came onto the scene. Synthesized by chemist Leandro Panettone, and the brand name of the medication, Ritalin, actually came after Leandro's wife, Marguerite, who was nicknamed Rita. And she found this medication helpful in raising her blood pressure, giving her energy for tennis matches. Now, the initial use of Ritalin or methylphenidate wasn't for ADHD symptoms. It was used for depression, for chronic fatigue, for certain kinds of sleep disorders. In the 1960s, people started to use it in children to treat symptoms of this minimal brain dysfunction, this hyperkinesis, which we now understand is close to ADHD.